This video is for the On Guard CSTD syringe adapter locks for infusion of high-risk hazardous drugs. Before starting infusions, make sure that your PPE is in place, so please view the medication in the MAR and follow the instructions listed for PPE. PPE is to be worn when handling the medication at administration and when discontinuing the infusion. The drug will be delivered from pharmacy in the bag that is identified as a hazardous drug. It is not a chemo drug, but is treated like one for administration and discontinuation of the infusion. The medication is to arrive at the unit with the medication tubing already primed with the On Guard CSTD syringe adapter lock in place and the bag spiked. The adapter has a locking system that will not allow the IV tubing to be removed from the adapter once attached to prevent exposure to the medication. The medication does not arrive with the tubing primed and attached to the medication bag or does not have the On Guard CSTD syringe adapter lock in place. Return to pharmacy for setup. To connect the patient to the adapter lock safety device, a Lure-Lock adapter will be used to connect to the patient's extension set needleless connector. So before you connect the Lure-Lock adapter, you want to make sure that you scrub your hub and connect a syringe and flush to assess the patency of your line. Once you've assessed for patency and you're good, you'll disconnect your syringe, scrub your hub again, and connect your Lure-Lock adapter. The next thing you'll do is you will scrub the hub one more time, grab your adapter, and what you're going to do is gently take your device and push down on the Lure-Lock adapter. You will hear and feel a click. To limit exposure to the medication, please do not use the flush bag system. When asked if you want to flush the line, continue by increasing the volume to be infused on the pump and empty the medication bag. At the end of the infusion, make sure that you don your appropriate PPE again as indicated and disconnect the adapter lock from the Lure-Lock adapter by pinching the tabs on the sides. The device will disengage without any pulling. When you're done, you'll now want to remove the Lure-Lock adapter from your needleless connector. You're going to dispose of your equipment, your adapter, your tubing with the locking device, the medication, and your PPE all into a yellow chemo container. You'll scrub your hub and then you will flush out your extension set. No setup is to be left hanging after the infusion. Perform hand hygiene after handling the medication.